look at a couple of the softer devices in the range now, and they are appropriately named the Bio Soft and the Bio Soft Plus. Now the difference with these two is they're not made from EVA, they're made from a dual density polyurethane. Now the great thing about polyurethane is that it's resistant to compression set, so that means it doesn't bottom out like EVA, and it sort of generally lasts longer. Also has brilliant shock attenuating properties if that's what you need. So although we tend to aim these more towards the elderly patients and the at-risk foot, you can also use them for sporting patients who need more shock attenuation, or maybe patients that come in that have standing jobs, so maybe policemen, people working in factories, those that wear safety boots. So shock attenuation or more your sort of elderly at-risk patients. Now the difference between the two, and the normal BioSoft is just as it comes with no top cover on there. And the BioSoft Plus has a memory foam top cover on there. So what the memory foam does is bottom out to accommodate the shape of the foot. So if you've got patients with rheumatoid arthritis or prominent metatarsal heads, then that will bottom out around that metatarsal head, but then you've still got the cushioning of the polyurethane underneath to dissipate that pressure. If you have a patient who maybe they have diabetes or they have ulcers and they have dressings on the foot, then you're probably better to use the normal BioSoft because you can wipe that clean. Same would be so if you're using it for sporting patients, whereas the one with the memory foam top cover is not quite so easy to wipe, so you just select that accordingly. Another thing that these insoles are great for are patients that come in with plantar heel pain. And that's because it reduces some of the plantar heel pain, and some of the contributions to that is the ground reaction force as they hit down on the ground. So because you've got a nice soft polyurethane layer in between, they're really good for those sorts of patients. Now you can see they both come in full length. You can add your additions onto there if you want to. Also, don't forget what you have in clinic. You know, you might have additions anyway that you can just peel off, stick on the front if you want to make it more bespoke to your patient. Or if you've just got things like pour-on or semi-compressed felt in your clinic, there's all sorts of things you can do to make your own forefoot additions on there should you want to, and that's very simple to do. So you can leave them as they are, or you can modify them effectively to your heart's content. That's obviously not a brilliant one I put on there. Don't forget you've got your nail drill in clinic as well, so you can bevel edges. So having a stock of these, you can make them very customizable to a wide range of patients.